watching Fox 45 Morning News. All local, all morning.
Well, still to come, a case of meningitis at Loyola University. After the break, the impact it could have on nearby campuses and the rest of our community. 7:22 is the time. You're watching Fox 45 Morning News, all local, all morning.
A Loyola University student is in the hospital this morning in serious condition, diagnosed with bacterial meningitis. And as you can imagine, there are now questions about the safety of other students on the campus and the community at large. Dr. Charles Haile, Chief of Infectious Diseases at GBMC, is joining us this morning. Good morning.
Good morning, Patrice.
So is there cause for concern for other students on that campus or even beyond the campus, people in that community?
I would say not so much. Make no mistake about it, meningococcal meningitis is a very serious illness that often leads to death or disability, but it's generally not as communicable as people believe.
So how is it spread?
It's spread by what we call droplets, which are tiny flecks of saliva in which the bacteria is suspended, but it rapidly falls to the ground and doesn't disseminate widely. So it's communicable, but generally only in a very close association within, say, 6 feet of an individual.
So this would be maybe the students' roommates or closest friends that they're around all the time.
Exactly. Eating at the same table on a regular basis, military recruits, people in very close proximity. They prevented meningococcal meningitis in the military by moving cots 3 feet apart. So that duration was helpful. Many students are already immune since they've had a meningococcal vaccine.
But when something like this happens on a campus, you know, everybody starts to get worried and they think every sign and symptom it means that they have this. What are the symptoms?
Well, some of the discriminating symptoms would be a very high fever, a severe headache, stiff neck, and a rash. So if those are symptoms that you have, then you should contact your healthcare provider. It can be flu-like in some ways, but it's a very precipitous illness that usually hits you hard and quickly.
So how does somebody get it in the first place?
Usually from another person, but there are differing strains of this particular bacteria. Some are more aggressive, what are called highly invasive strains.
And how long would you have this before you knew those?
You may have it and never get meningitis, or you may have it for several weeks with a mild prodromal symptoms of sort of a upper respiratory infection.
So the person who has it and is in the hospital could have carried this for weeks and passed it to people along the way, not even knowing that they had it?
Possible, but not likely.
Okay. What do you do to treat it? And for the person in the hospital, what's the...
Well, it's highly treatable. The question is how early to treatment does the patient come? If they're coming when they're still alert, conscious, outcome is usually good. Often it's very good even if patients come at a later date. It's treated with heavy-duty aggressive antibiotic therapy, highly technical supportive care, and close observation.
You say most people have already been vaccinated against them?
Most college students would have had vaccination either in high school or on entry into college. I don't know that it's a requirement for vaccination, but people are highly aware of it these days.
And if they haven't been vaccinated, they can always go now.
It's a good idea.
To get
it's
that
a good
done.
idea.
All right. Dr. Haile, thank you. You just put a lot of people's minds at ease. Thank you very much.
You're very welcome.